Today I'm going to give you some top tips on clinical decision making based on my years of clinical practice and education. I have found over the years that one of the most important things of how to make a clinical decision is how you engage with the patient. By that I mean how you communicate with them in the first instance. Do you use open style questions, closed style questions? And one of the best ways I found of doing that and to work in a structured way is to use a framework called ICE. For example, I would say, tell me what your ideas are, what's wrong, what are your concerns, what are your expectations? And allow them some time to talk at this stage and listen well. Then perhaps I would use more structured frameworks, for example ABCDE, to gather more objective data, and AVPU, and of course vital signs. At times, for example, if the patient was, for example, shortness of breath, I might focus that history in a more structured way by saying, well, tell me more when it started. Tell me when it started, when it got better, when it got worse, what makes it better, what makes it worse, and any associated symptoms with it. Then I would assimilate all that data together, and I'm thinking about, well, how am I going to make a decision? Well, first of all, I've got all of the information that I've gathered from the patients. That's the patient knowledge. Then I'm thinking about, well, I've got my intuitive reasoning here, my intuitive knowledge. But I also be thinking of the knowledge that I gained from practice over the years where I've seen similar cases. And then, of course, I have my theoretical knowledge that I learned in education. I would put all of those forms of knowledge together to make a clinical decision, but most importantly, I would not make that clinical decision without thinking what the patient thinks it is. No decision without me. That's my top tip of how to make best clinical decisions in clinical practice.